Hello, everyone. I know you're all wondering how am I doing after surgery, getting my hysterectomy done. I'm doing okay. Each day is getting better. It's very painful. I need help like getting up and getting around because Quan and my mom don't want me to fall. I have six surgical scars altogether. Five is on top of my stomach, and one is in my navel. Surgery went fine, just like me, a couple of little hiccups or whatnot. Um, when I went there, it was like totally different. That was the first time I've ever had surgery at Centerra, Virginia Beach General Hospital. I'm used to when you go back, being behind a curtain, but I had a door, with my own bathroom and everything, which was great. Then they had like a swivel TV which wasn't like up on the wall. It was more close to you, so you wouldn't have to really use the remote for the TV. You could bring it as close as you want to. Mom thought that was amazing because you know with her being with me all the time when I go to get surgery, we hadn't seen anything quite like that. I ended up having to get an IV, which doing surgery, that's what you get. They had a difficult time trying to find a vein. The lady wanted to put it in my thumb, and I was like, no, can't have it in my thumb. It's too painful. But she ended up putting it in the side of my arm, to which now, I have a bruise on my arm from it, if you could tell. Um, that should hopefully disappear really soon. Um, then I had ended up getting a pad on my back to keep me from getting sores while laying on the operating table. Um, I did have a problem with before going into surgery. I went to the bathroom and I was breathing heavily once I returned. So they couldn't give me the medication that they give you to put you in the twilight zone while heading to the operating room because I was already out of breath. So once I got to the operating room, they had to slide me over to the table because they didn't want me to exert myself from moving from the bed to the table. They had to put a mask on me that gave me oxygen to put inside, to fill up my lungs so that they wouldn't have any problem because the doctor did come in um, while I was waiting in the room and asked do I think my lungs would hold up? And I said, yeah, I had a big old talk with them, so they know what to do. And I had met so many nurses and doctors that came in before I rolled into surgery. They was really nice and everything. But back to the surgery, the mask itself that they put in to give me the oxygen, I started to hyperventilate because all I could do was smell the plastic. They did remove it, but kept it close enough for me to be able to get the oxygen in my lungs before the surgery. I don't remember too much after that, except for waking up in the first recovery area. The nurses were really nice and everything. I did have a catheter in, and like they had told me before surgery that it would stay in. I went to the second recovery. That's when they took it out, and they informed me that um, if I don't use the bathroom before I leave, my bladder don't wake up. That they would have to put it back in, and then I would have took it out the next day. But I told them, oh, my bladder will wake up. I have no trouble with my bladder waking up. And, anyone that's had a catheter know that they take it out and then they put some kind of other fluid in you to see will you go to the bathroom. And that I did. So I was able to go home the same day. I suppose I got my estrogen patches, but they forgot to give them to me. So now I have to wait till tomorrow to get them. And um, because they're out of stock, and hopefully I do get them tomorrow because I do not want to have to go through menopause. Um, so surgery, overall, once I got home, Quan drove. He was really good with that. Once I got home, got in the bed and slept most of the day. Well, majority of all the day, trying to get the medicine off. And then too, they had gave me different medications to take. Pain medicine, um, some for muscle aches, and also for constipation because the pain medication can cause constipation and then, having all that gas in your stomach and everything. I did look like I was carrying triplets at one point. Now I'm probably down to carrying twins. Um, and uh, it's been really different. This surgery has been, I guess, because I'm getting older now, but at least it's surgery number one out of the way with three more to go and a procedure. I've been getting up, walking with my mom. You know, she'll take me to the kitchen, to the door, just so I don't get stiff and be laying in the bed all day. Like right now, I'm sitting up. I've been playing bingo with her too. She tried to keep me up, and so I can have energy and don't lose what I do have. She can't wait till I'm back to myself. I told her it won't be long. I'll be up moving around without any assistance. Um, I go back. Oh yeah, also I go to radiation also, and no, I do not have cancer. I go to radiation because I have keloids, and every time I get a surgery, I have to go to radiation to prevent the scars from forming keloids. I have 4 sessions of those. I went to my first one on Friday. I have 3 more to go. Monday, Wednesday, and Friday of this coming week, which I'd be happy because they do drain you. Radiation is radiation. It may be different type that I'm receiving than someone with cancer, but to me, it's still tiring and still laying flat on the table and just having surgery is a lot of pain. Um, I have lost a little bit of my appetite. I don't eat as much as I did. You would think I had the weight loss surgery. But I guess with all the medicine and everything, uh, once it's out of my body, I'll be back to eating. But it's good that I am losing the weight because I have a follow-up visit with the weight loss doctor. But the surgery so far has been fine. I am on a lot of restrictions for now, in between 4 to 10 weeks of restriction. I go back for a follow-up with the doctor on the 24th. Um, and I just wanted to get this quick, recovery follow-up video on my surgery. I have a good support team. I want to thank everyone for all your well wishes and checking and calling up, texting me and seeing how I'm doing. My mom and Quan, they're taking very good care of me. Basically, I'm not able to do too much, so they've been my right and my left hand, and even our dog. um, he knows that something is wrong, so he will alert them when he thinks something is wrong with me. Because also I have to also been having more passing out seizure spells because I have to cough so hard now, and with so much pain I just pass out. But luckily my mom or Quan is always close by to uh, wake me back up and kick me out of it because it only lasts for a few seconds, which is scary. So I'm probably going to have to get that checked out again after I recover. So this is just a quick video once again to let y'all know how recovery is going. So I hope y'all have a good day, and I keep you posted on what's to come next.